There are growing concerns, though, about how the United States is actually responding to the monkeypox outbreak as we continue to deal, of course, with COVID. The WHO declaring a global health emergency over monkeypox, saying that a coordinated international response is required to stop the virus from spreading further. More than 16,000 cases have been reported in more than 70 countries. In the United States alone, nearly 3,000 cases have been reported in 45 states. Roughly a third of the U.S. cases are in New York alone. While the vast majority of infections have been reported in men who have sex with men, anyone can get infected with monkeypox. The CDC has confirmed 2 cases amongst children. Health officials also aware of 8 cases amongst women here in the United States. And the demand for vaccines, it is far greater than the supply that we have. With us to talk more about this is Health and Human Services Secretary Xavier Becerra. Secretary Becerra, thanks for joining us on this. We appreciate it. So you talk about accelerating our response in the coming days when it comes to monkeypox. What does that mean? What does that look like?
Yasmin, let's try to put that in perspective. We are now at around 3,000 cases, as you mentioned. We have now acquired and begun to allocate almost completely more than 300,000 vaccines. And so what we're trying to do is make sure we are targeting communities so that we're getting them where we see the cases and as well where we see most people who would be at risk. And so we'll continue to ramp up in the number of vaccines because we know that it is spreading, but we're going to try to do everything we can working with our state and local health partners and the communities that are most at risk to make sure we try to prevent it and then can treat it if someone does catch it.
So let's talk about a couple things there that you laid out. First and foremost is communication, right? Folks, whether or not they should be worried about this outbreak of monkeypox, how bad it could actually get. What efforts is the administration making to communicate about monkeypox and the risks involved to the country?
Well, since we found out about the very first case in mid-May, we have been in contact with state and local health officials. We have been in touch with the communities most at risk to try to give them a clear idea of what monkeypox is. And again, remember, most Americans still aren't familiar with monkeypox, and there are a lot of clinicians who still aren't familiar with it as well. So we've been constantly in touch with those who need to know and those who need to be protected. Now, we need to have that ramp up because what we're finding is still the public isn't getting that much information and people aren't familiar with monkeypox. So it's a matter of education. By the way, this is a virus that we can more effectively protect ourselves against, prevent from ever getting, because unlike COVID, for example, which we know can spread through contacts even a few feet away, this is very different. It seems that it will require some type of close contact in order to acquire monkeypox.
You say communities at risk, right? Focus on communities at risk. Which communities are most at risk right now, from what you know?
Well, what we know is that most of the cases involve men who are having sex with men, but there are others as well. Because it is based on contact, it can be anyone in the population. Every American should be aware of this and take precautions. But what we're going to try to do is make sure populations that would suffer most, have the most risk of having a really adverse consequence are those that we're targeting for help most. So if you are in the LGBTQ plus community, we want to make sure that if you happen to have HIV, that we're doing everything we can to get to you quickly with a vaccine, because we want to make sure that your level of vulnerability doesn't impact what you can do in the future.
Secretary Becerra, I also want to talk about the 988 helpline, the suicide helpline that the administration has set up. Talk to us about this and how you're communicating about it to the public.
This one's a really important one as well, Yasmin. Thank you for asking, because we know that there are more Americans that are suffering real stress, in some cases distress, much of it brought on by COVID, and we've seen the numbers of suicides, the number of cases of mental health services go up, and so what we're trying to do is get ahead of it as much as we can. 988, that's a new 3-digit call number that you can use, a la 911 for emergencies. If you are suffering from mental stress, mental distress, 988 is a quick number that you can remember and call and get support and services. We have seen in the last week since we launched 988 nationwide, this is a number really operated by the states, but we've been helping tremendously, about a 45% increase week over week from when we didn't have 988 to having 988 in terms of the number of calls, texts, and chats that are now being received.
That's tremendous. So if you're having a mental health crisis, you pick up your phone as you would 911. In an emergency, you dial 988 to speak to someone on the other line when dealing with that mental health crisis. And I'm wondering what the administration plans to do to put more resources towards erasing the taboo surrounding mental health issues in general, that it's okay to suffer sometimes.
Well, and President Biden made that very clear, not just through his State of the Union address, where he talked about the investments we're going to be making, but in his budget. He makes historic investments in mental health care that we've never seen before, and what we have to do, absolutely, if we're going to treat mental health the way we treat regular physical health. And 988 is a perfect example. The year before President Biden came in, about $24 million was spent by the federal government to help stand up 988 as a nationwide call number. In the president's year and a half, he has invested more than $430 million to get it going. And so the reason we're seeing some success throughout the country is because of the kind of investment that's been made by states, but also by the Biden administration.
I just want to remind folks, once again, if you are suffering from mental health issues, you are having a crisis, you can pick up your phone and you can dial 988. And from what I'm told, and Secretary, correct me if I'm wrong, someone will pick up on the other line. You will not get a busy signal. You will not get an answering machine. Someone will pick up and someone will, in fact, help you. Secretary Xavier Becerra, thank you so much. We appreciate it.